here. So welcome to our first safety webinar of 2026. Super nice to have everybody here. Thank you so much for taking the time out of your evening. Tonight, I am super proud to announce that we have our community assisted response and engagement team. So I know that Amy, Barden, and team will really get into what they do and answer all the questions you have. I'm just going to do a brief intro because I would be very remiss not to. So our care department is our third branch of public safety alongside SPD and SFD in Seattle. Here we are very fortunate enough to be able to treat them as such. They are their own unique department, so they are not tied to PD or FD. They were established in October 2023 in the CID in downtown, and they operate both the 911 communication center as well as non-emergency, but also our community crisis responder team. They were expanded in 2025 to citywide to include 24 responders and 3 supervisors. And thanks to the Seattle Police Officers Guild contract that was signed last month, they're going to be expanding again to almost double. And what I really love about CARE and about Amy in particular is that this methodology and this department does not look at communities as a problem to solve. They really changed the narrative by seeing survivors instead of issues or statistics, and recognize that every person has their own story and may have an answer that we don't have yet. Amy in particular only thinks about people in the context of being loved. I'm seeing some sound issues down here. Hang on. Sorry about that, y'all. Let me see if I can make this any clearer here. Better? Okay, I'm getting a thumbs up from Rick. All right, good. Cool. So the folks at CARE only think about people in the context of being loved and really look at the systemic issues instead of blaming the societal problems. Amy leads this team to focus on strengths and potential instead of really looking at deficit-based ideology and failures. So it is my absolute honor to be able to introduce this team to you, to be able to work alongside them in various capacities, and to call many of them my own personal friends. And with that, I will kick it over to Chief Dr. Amy Barden and her team.
Well, thank you, Dr. Carl. That was honestly the most lovely introduction I've had by a mile. It's funny how people always go through resumes, and that's not what I care about at all. To be described as somebody anchored in love is the best possible scenario for me. So I have with me Jake Adams, who is Chief of Staff for the Care Department. Jake, do we have any other colleagues on? I don't think we do yet.
Kat's on.
Oh, hi, Kat. And Kat Hernandez, who is the Kat. That was a bold move to make yourself known, because I'm gonna make you talk a lot. And Kat Hernandez is the care team manager. So she really directs. There's 3 divisions of the department. The first is Seattle 911. We have a deputy chief over that. The second is this care crisis responder division. Jake and Kat are leading that development. And then the third division will be an Office of Violence Prevention, centering and coordinating the community violence interruption, gun violence reduction, perhaps survivor support. There's a whole bunch of different public safety functions and investments that are scattered across 39 different departments in the city. And so we have silos, not because people don't want to collaborate. They're just by design. That's the way government does government, apparently. So I think most of you are well aware when I looked at the attendee list, but the department was established initially in 2021 and then more fully in 2023, the year I arrived. So by the end of the year, we had a new ordinance. That council was much more clear about the potential of actually investing equally in a third branch of public safety. I'm novel in the country in that I'm looking at 911 data primarily. That is the whole premise for design. If you look at those 900,000 calls, what types of calls are they? I learned quickly they're public health calls, right? And then by the second year, I realized, we're conflating accountability and punishment. Those are totally different ideas. And we're not actually sending the right first response most of the time. We're defaulting to police, feeling like better safe than sorry. And on the contrary, right, the data says for many types of calls, this is much more likely to go poorly if you send a gun and a badge, that no matter how skilled that officer is, that can certainly be traumatic and it can escalate a person. And so we point to research. Jen is a part of that, right? Contributing to that field. What should this look like? And the basic idea is we should invest in early intervention first and in prevention and then in diversion, right? Meaning we're trying to avoid criminal legal contact. And we should only use coercion, in my opinion, when we have failed, right? And somebody is continuing to harm or to self-destruct. You should intervene still. However, I want that coercive intervention to be into a system that is humane, that essentially looks exactly like the behavioral health system. The only difference is the voluntariness. I have big issues with jails and corrections, and everybody gets to hear a lot about that right now. And then, sort of the future state would be, can we provide for successful reentry? So if we think that somebody is stabilized, they're healed in some way, they're able to return to community, how do we provide a line of sight to ensure that there's the support needed until somebody is more autonomous and independent? And where does the nonprofit sector sit? Where does the public sector sit? So I'm going to, Jake, if you would just say a word about Seattle 911. Jake and Kat both were 911 supervisors. And Kat was so fortunate for me when she applied to be the care team manager. It was really, to me, it was a godsend because she's got this really unique understanding of first responders, of dispatchers, and how all of that works. And she has an MSW, in this crisis work background. So Jake, first, if you would just say something about where we're going with 911 this year. And then Kat, if you want to talk about where we're going with the care response this year, and it will make me probably fatigued listening to both of you and what we're about to do.
Absolutely. And first, I love Kat's background because as part of her hiring panel, she is out of this world. But for 911, first of all, Seattle's 911 center is the largest 911 center in the Pacific Northwest. We only handle police and care responder calls. We take close to 900,000 calls. Right now, we're going through an era of trying to responsibly apply the technology that's coming out, in addition to trying to cement our staffing issues. Nationwide, 911 centers have staffing problems. We're no stranger to that, but we're one of the more healthier centers in the nation. So this year, we're hoping to continue to gravitate towards change and be more positive about technology, but also trying to figure out what can work for us. So with Amy, with her leadership and with all of our team's leadership, we're trying to acquire different innovative techs. One of them would be integrated data to understand the data better. We're trying to do better quality assurance. We're trying to have a way to automate our quality assurance to where we can ensure that our call takers are following the protocols that meet the city's needs and the people's needs. From there, we're also looking at automated translation and transcription technologies that include a bevy of different products that can enhance the experience for the call taker and the supervisors in the room, from automatic notifications to say the AI product is listening and can alert people in the field or in the room of certain situations that are developing that can prompt automatic call creation. Essentially, we're trying to look at all of the available technologies out there to make the job more efficient. If any of you have ever called non-emergency line, that's one of them. That's going to probably be the last thing I do before I retire here, hopefully. But it's to make that non-emergency line be answered within 30 seconds or 0 seconds. And so I know that's probably a mountain to climb, but those are little things. We're also looking at automated call generation. So essentially you could go online or you could text a bot and you could tell them what's wrong and it could automatically create a call. And all of this is done not to take away jobs, but to ensure that people calling are getting a fast response. Essentially what happens is right now you have people talking on the phone, and we're just going to reimagine what some of those jobs look like so they could be facilitators of the online equipment. And so that's what we're looking at right now. Additionally, we did get about 12 more staff for 911, including 3 support staff, so 15 total. And we continue to hire to full staffing so we have enough people in the room. That's kind of a quick nutshell of 911. Anything I left out?
That was great.
Okay. From there, thank you. I'll pass it to Kat, who could give a breakdown on what we're doing with CCR.
Yeah, so as mentioned, I'm Kat. I'm the manager of the care team crisis responders, and yeah, I started in 2018, and Jake was in fact on my hiring panel, and I've just been like chasing him through positions in the department ever since. He cannot shake me. Uh, he always has to supervise me, no matter how much he tries not to. But yeah, I come from a mental health background in mental health case management, transitional housing, have my MSW, and then came back to Seattle and discovered 911, which works perfectly with my enjoyment of crisis and things being on fire, figuratively and literally. And went through call taking and dispatching and supervising. And in that interim, actually had some meetings with some folks at the city and with our interim leadership about increasing our use of auxiliary and non-enforcement resources and how we could be doing better in that regard. So seeing that come to fruition with the program in late 2023 was amazing. And I joined a couple months after the program got started. And it has been a lot of growth since then. So we started with 6 folks just covering originally the downtown core, but we pretty quickly expanded because we said if we have the capacity, we're not going to sit around and say we're not going to come to you 2 blocks north of Denny, even though we're available right now, because it's technically a different color on the map screen. That would be silly. So we really quickly expanded that to all of West Precinct, and also just realizing that why make people memorize extra maps or rules whenever we can. We want to lean into the existing infrastructure. So we followed the same precinct boundaries as officers. We're on the same radio channels. Anything we can do to streamline kind of with the existing public safety system, to kind of take all the good things about it and don't feel the need to pick up anything that doesn't work for us. So since then, the team last year quadrupled, and that allowed us to have 8 folks per zone instead of 6, and to expand to the additional 2 zones, as we call them. So we already had Central, Downtown, which had expanded in the summer of 2024 to include East Precinct, Capitol Hill. And then we opened up offices in South Seattle and West Seattle, and also across North Precinct. So now our next great challenge this year is the team is doubling again. So last time we were able to expand geographically. This time we'll be expanding as far as our hours go and our consistency of our availability, because we do want to chomp our way towards like that 24-hour coverage that is really a hallmark of public safety and that reliability of service, that no one has to do kind of the math of, okay, it's a Tuesday, is it a full moon, is it this type of holiday, just that, like, this is a resource that is consistently available, is where we want to get to. So we'll be adjusting to, instead of being noon to 10 p.m. 7 days a week as we have been, we'll be 6:30 a.m. to 1 a.m. 7 days a week. So that'll be what we're working on this year, in addition to a lot of expansion. And I mean, we're always iterating and further developing our infrastructure, our policies and procedures, our training program. We have a great in-house training manager, Rose Nakano, who does a lot of work on developing our 4-week classroom experience and 4-week field training experience. Then also operationalizing some increased access to direct response. So we've always gone out a lot to secondary response for officers, dual dispatch where we're sent in tandem and arrive on scene together, and a lot of proactive engagement in community, where we go out and we either approach people who we think might need services, or we're available to be flagged down by folks who know us and think they could use our assistance or just have questions. And we've always been able to do some primary dispatch, but it was much more limited. So our latest updated contract between the city and Seattle Police Officers Guild will give us more direct access to calls, so that they don't even need to touch enforcement if it doesn't require it, basically, is the goal.
Good job, Kat. I will add that as of January 1st, we have oversight of the lead contracts, co-lead, which is an emergency housing resource. Basically, it's hard to case manage someone if they don't have a safe place to sleep. And then we deliver care, which is a sort of a milieu management team you may have seen in the city. Those contracts are really significant. I'm glad that they moved over to us, because we are all in the care department what's called CJIS backgrounded. So that's an FBI clearance level to work with law enforcement data and around law enforcement technology. I like that because it allows the care responders to be really integrated with police, fire, EMS. That's good. We're all on the same channels. It provides safety if care goes out and they need backup, they can radio, just like firefighters. What's problematic about the design is we know how important the role of peers is in the work, that many more times than not, it is somebody who has lived through this circumstance who can drive that sort of consent-based solution. And so I'm precluded from hiring folks specifically with lived experience unless it was like way far long ago under certain circumstances. And so the solution for me is to make sure that we have these different partners, different community-based resources. I often explain to people, we're not case managers. The care responders are first responders. The idea is to send someone, instead of a cop, to a call, rapidly assess through a clinical lens, right? Through the best possible lens, and then hand off to the right resource. And so that's the most fun part of the work for me. I'm from the nonprofit sector, and it's really fun to serve as almost a connective tissue. Who is doing what? Where are there gaps? There's certain calls where I'll think, oh, well, I can think of 15 resources for this person. There are other people we interact with where I'll read the notes later and think, I have no idea. I have absolutely no idea, this set of conditions where I would take that person or who could best help. And so it's going to be a good year. I think just even this mayor and the new county executive like each other and talk. And I think that's significant. I feel like all parts of the system need to be working together. You can't silo homeless response from crisis response, from, criminal legal, we all need to be anchored in the same productive direction for the person, making sure that the system is meeting someone where they are and then helping them to move through. One of the things I like to talk about is how flawed the concept is that we're looking for, who's the mental health call and what's the criminal call and that's just ridiculous. Anybody doing crimes or destructing or self-destructing, causing harm, that is not a normal way of being. That is antithetical to the human brain. And so I talk a lot about that we need to just reset and acknowledge that these are all behavioral health calls. And I'm not suggesting when I say that we don't, again, sometimes need a coercive intervention to save somebody's life. You can't see this, but I have a really bad cold, and my husband just came down to refresh my throat coat tea, and I think that's awesome. So as these contracts come into the department, the idea is, okay, if we see that, somebody's in the CAD, right? They've popped up in our data. Can I just know if they have a lead case manager and just call that person and reconnect swiftly? And then if lead, that outpatient case management, if we can see that somebody is decompensating still, if they're doing more crimes in 12 months, it's not working. It's not working. And we need to try something else. We need to actually be scientific about this because people can and do change all the time. I was with Pure Washington and Capitol Hill today. Devontae and I were there. And it's just, I say that all the time, and then I get up close and hear people's personal stories. And the best leaders in our city have spent time in jails and prisons. They have. And so I'm very committed to that. That's really the mission, is to design a society that acknowledges people can change and that's scientific enough to set up interventions that will predictably support somebody in that change. So Jen, is it okay? Should I pause for questions, or do you want to moderate some situation? What's next?
I am entirely cool with whatever you like to do. I know you love a good Q&A.
I do.
So
yep.
I figured I would let you handle whatever you're comfortable handling, and we can go from there.
Yeah, please. It hurts my feelings when people don't ask me questions. And generally, I find what people are most intrigued about is like criminal legal system, politics, right? I mean, how does this stuff work? Why are we a statistical outlier with relation to homelessness? Because we are, and with rates of overdose death as well, and actually with rates of attempts to die by suicide. So that's usually what I'm talking about, but you can ask me anything and I will try to answer.
Erin, I see you've got your hand raised. Go for it.
Hi, how are you today?
Hey, Erin, good to see you.
Good to see you. Amy, how are things going to change when the care office opens up? I believe, what is it, 12th and Jefferson?
Mm-hmm.
Is anything going to look or feel different in this neighborhood? Who are we going to see? What are we going to see? What are we going to
Yeah. Yeah, that's a great question. So I really believe in place-based strategies and sort of relationship-centric solutions. Back in the day, you did have police beats, right? The idea was, okay, and that's all we really had was law enforcement. Do they know the business owners, and do they know the schools, and do they know the people who are frequently impacted in some way or impacting the system? And that familiarity really matters. It does. It's important to know for all of us, okay, who knows this person the best? Sometimes care has gone out, they're interacting with someone who's, again, sort of resisting support and the help that they need. And then we learn, oh, this officer knows them the best. And we've called them out and the officer can have the conversation. And it's not because they're better trained necessarily, it's just because they have a relationship. So that's what we're trying to do with care, is to proactively identify where are these crisis calls coming in. You can see there's about 10, we call them hot spots, but they're neighborhoods. You'll have a 4 or 6 or 8 block radius where there's just a ton of what I say social work calls. Mm-hmm. It is overdose, it is mental health, it is folks who are unsheltered or who have something going on mentally. And can we proactively be in those neighborhoods and get to know people? And one of the nice things about being, again, in that CGIS environment is we can protect the information. So we're not tracking very much, but we can at least know who the case manager is and what's observed, what worked in the past. So that's my hope. Capitol Hill is not doing well. So it very much frustrates me when leaders are calling mission accomplished about crime statistics. I feel like this isn't helpful to this person whose car just got stolen. And in some ways, again, the trends they're either lagging behind the national and even the local trends. Some ways it's worse. We're actually getting worse. It's true that people just aren't reporting property crime anymore. They're just not. They're not calling 911 because they don't think anyone's going to come or it's going to take 5 hours. They're not filing an insurance claim because they don't want their premiums to go up or they don't want to lose their insurance. And so I just want you all to know that I know that. I know that Councilmember Hollingsworth knows that. And I feel like, we can staff up police, sure, but we're not actually simplifying the system to be able to avail the person of resources. So if somebody is doing crimes like misdemeanor crimes and is also unsheltered, you have to address that unsheltered thing. Mm-hmm. If they have a place to stay and they're not staying there, you got to figure out why is that. And I've heard some pretty valid reasons. I was talking to one woman my first year and she said, she was in a PSH environment. She said, no, I have a place to stay. But she said, I've been raped there twice. I'm not going back. And I thought that makes perfect sense, actually. So I think that we forget, criminologists who are good will tell you there's always a rationale. It may not be logical to us, but there is a rationale. It's not true that everybody's service resistant. And so, Erin, we're really going to be watching, around the polyclinic. That's an area of great concern for us. Obviously, the CID in Little Saigon. And then in broader city, Lake City is really, really, really challenged. Ballard is really challenged. And often it is, near food banks and near different services. And you run into this sort of jurisdictional thing where it's like, oh, well, that's public property. That's not our responsibility. And we just have to stop that. So I know there's going to be a care open house. I think, Jake, is it this week at that location?
Yep, it's this Friday. Let's see here, 3 o'clock, I want to say. Yep. No, 4 o'clock. This Friday, 4 to 6.
Yeah. So, Jen, I'll have you circulate that invitation if anyone wants to swing by and, just see the responders, what they look like. We're also, now that we've got a new mayor's office, a new administration, we've proposed for some time, probably a year and a half, whether or not we can publish a direct line to care for especially like permanent supportive housing environments where you just are going to have a lot of crisis calls. Can you just go directly to us? These are clinical people. They know what they're seeing. And I have been told no without explanation. And I believe this year recommendations like that are not going to be declined. So thanks for the question, Erin.
Thank you, Amy.
Rick, go ahead.
Okay. You have a number of categories, I think four, for classifying calls as they come in to determine the priority as you're triaging them. Are those set by law, by statute, or by administratively?
Oh, that's such an interesting question. I'm always surprised when I get something brand new. No one's ever asked that. So there's industry standards in 911. There's different response times. There's like governing bodies, basically APCO, NINA, so that you kind of have some guidelines and just normal practices, normative practices. And then there's a ton of discretion by jurisdiction. So my second year on the job, the most interesting project I was part of was this call prioritization project. What had happened was you to your point, you've got priority 1, 2, 3, and 4. Priority 1 is supposed to mean urgent threat to life, like go, this is all units go. Priority 2, also quite urgent, like things could be much worse in 20 minutes if we're not there. Priority 3, the basic thinking is it is an emergency. It's a 911 call. It shouldn't be rerouted to non-emergency, but you don't have the same urgency. The way that I think about it is it's probably not going to be a lot worse than 30 minutes. We want to get there as fast as we can, but priority 4 is more like reporting. I think about it like, my bike was stolen 2 days ago. It's not more stolen, right? You do want to file that report. There's a criminal aspect. When I arrived, and Jake really helped me to understand this, we were basically classifying in 911 everything as priority 1 and priority 2 because we didn't have officers left. And the feeling in dispatch was, if I make it a priority 3, nobody's ever going to go. And it's a very human instinct to sort of upcode, right? So that the person gets help. Well, it was actually my future husband is the first thing we argued about. He was the deputy chief in SPD when I met him. And he said, Amy Smith at the time, he was like, Chief Smith, you can't call everything priority 1. That means nothing's priority 1. And I was like, marry me. Yeah. So we, went through this like 90-day process of really going through how do you define urgent? What is a threat to life? How do you make a judgment call like a DOA, right? We found somebody who's deceased. That is a tragedy, that is urgent, but it should not actually be prioritized over this armed robbery where we could potentially save a life. And so Jake led that work, Kat worked on that, and then the deputy chief of 911, Charlotte. Where it is today, Rick, it's priority 1 is supposed to mean urgent threat to life. We think somebody could be deceased in 5 minutes. That's what it is. And that process going through, we didn't get to priority 3, but we went through 1 and 2. Within about 6 months, it cut the number of priority 1 calls in half. Now, that doesn't mean there were fewer crimes. It just means that there were different priority levels. And what was really troubling about that is we still weren't getting there faster. My theory was, we're freeing up law enforcement. We're making it more clear where they need to go first, but you still very often have response times around 10, 11, 12 minutes to priority 1. And again, that's one of the reasons we must grow out these, alternative responder units. People don't understand in this city that even when Seattle Police Department was fully staffed, high water mark, 1,500, this was like in 2018, early 2019, and the population was smaller, 10, 15% smaller. They still took on average at least 72 minutes to get to priority 3. So it's a myth that you can just staff the police department and we're good. The crisis calls, the people that you see struggling on the street who do not have a weapon, generally those are all priority 3 calls. And the care responders, when we're able to go solo, we're still on average getting there 8, 9 minutes. And again, that's the nice thing about the place-based strategy, right? If we're really close to these crisis locations, it allows us to be there in 3 to 5 minutes. And we basically have access to the system, the same as police do. We can take people to the Crisis Solutions Center. Now we have the Orca Center for people who want to get off fentanyl specifically. We've got the long-lasting injectable there. That's 24/7. We'll have those different crisis care centers. We've got connections and things like that. So that was a whole bunch of words, but the short answer is we have a lot of discretion to set up the policies that say this is priority 1, this is priority 2. And where Jake talked about quality assurance, we're trying to get much, much better about when is a supervisor listening to perhaps upcode this. it's helpful for me when you all send me a note about when it didn't go well. I called this in, it took 4 hours and this was an emergency. And then we can go back, we'll pull the tape basically and figure out what happened. And sometimes it's like, well, we only had 5 officers and they were all on these priority 1 calls. Other times we're getting it wrong in dispatch. Something new became known about the situation that did not make its way into the notes and change the priority from 2 to 1 or from 3 to 2. And so again, it's helpful. Sometimes real time, I can intervene and call the supervisor and say, hey, will you look into this? I've got this scenario. I want to know what's going on. Did I answer your question kind of? Plus 10 questions you didn't have. That's usually my deal. Yeah. You're on mute, Rick.
If we were to want to consider certain things and suggest that they be recategorized,
Yeah.
who would we speak to?
Me. You can send me a note and I can start that conversation, because generally, as long as I've got to get, if it relates to medical emergencies and, the fire department, those thresholds, we do this work together on again, that call prioritization, that was SPD and CARE hammering this out. And there was a lot of debate about it.
Mm-hmm.
Occasionally, if we ever need someone to break the tie, that's going to be the mayor, or sometimes the city attorney. But this should be living work. It should be changing all the time. It should be, based on the data. One of the most interesting debate for me on the topic was about domestic violence, DV calls. Basically, anytime it was like, I hear a man and a woman arguing, we were calling that like priority 1 DV. Even if there wasn't evidence that there's even a relationship here or that it's escalating, there was such a fear that the worst could happen. And again, I found the debate interesting because I could have argued both sides. But what we're trying to do is really look at the data. And then as we add in AI, right? And you've got more people listening to the call, we know based on location sometimes, oh, this is probably an overdose and not a stroke, based on what it usually is on Friday night on the street. And so that's where it gets really squishy. We don't want bias, but we also want to be able to exercise discretion and judgment. But yeah, you can, it's just amy.barden@seattle.gov. You can reach out to me.
You've mentioned AI twice.
Yeah.
And I thought that was considered an anathema within the city government.
Yeah. Let me tell you what I'm talking about specifically when I say it. And yeah, you get Scrabble points for using anathema. So there's new technology in 911. People have never really used any technology, which is so wild. I thought it was going to be like the movies, right? It's just, the best in class. And in truth, you've got dispatchers memorizing everything. And, even it was a while before like that Google Maps technology, before that was used. And it's not just Seattle, it's everywhere. It's an industry issue. The industry is thought of as like the secretaries, rather than the first responders, where you would want everything known that could possibly be known. There are technologies now. One's called Prepared 911 is one of my favorites, where you basically are, I'm trying to think about how to simplify this. You basically have language processing going on real time, listening to the call and recommending. These are other questions the dispatcher should ask. When I had my little research fund prior to this job, one of the things I loved was content analysis, because you can, if you really look at just how many times does this word show up, that you can learn a lot just from looking at that. And so that's what I'm talking about, is just predictive analytics. Does this machine think it's most likely a co-response needed? It's most likely police response. Another aspect of that technology is once somebody says blood, it should signal my supervisors, right? There should be somebody else listening to this call, so the onus isn't just on one person. And we don't have that technology right now. It's just completely random, whether or not somebody happens to jump in to help sort of case conference. So, I'm looking at the chat now. Yeah, I can have Jen circulate some of the technologies that I like, because I also don't want to freak anyone out. I'm basically just talking about better tech support for the dispatchers, and it's still humans who are using judgment. I didn't see last week's episode because I live 911. I have not watched that show.
And real quick, Mr. Grossman, just to kind of elaborate a little more, some of the things are like the chat bots that these days people don't want to call. They want to text. They want to be online. And so that's a technology that is vastly underused across the nation. There's like an old joke in the 911 industry where the technology is 30 years ahead of the equipment in the 911 center, unfortunately. And so as these techs keep advancing, we're missing out on tools that could just make the job more efficient and kind of speed up some of the delays. It's not meant to roboticize the work at all. The Privacy Act that Seattle has, it's not meant to invade any privacy either. So we have a pretty intense city policy on privacy. And anytime we even mention AI, and IT folks will just pop up out of the woodwork and say, what, and start grilling us. But jokes aside, we have a pretty intense privacy and security review that we go through. That we wouldn't get any technology approved if it put anybody's privacy at risk, their information, if it exposed people, where it's stored, who has access to it, et cetera. All of that is heavily vetted by the city.
And another feature that we desperately need is automatic translation and transcription for people. So right now it's the same as it would have been in the 70s, where we're trying to find a translator to talk to a person. We've got over 200 languages spoken. And so, and again, it's very imperfect technology right now. But when you think about Google Translate, the solutions that exist that especially could help with text to 911. So recently we had a call go poorly because my dispatcher guessed the wrong language that they were hearing. And the person truly had no English whatsoever. There was somebody who was bilingual themselves. With a Southeast Asian language and basically guessed the wrong one, got the wrong translator, took a minute, but there was harm done during that lag. We never get to talk about this. It's fun to talk about, actually.
Are there gaps between your systems and the police?
Well, yes and no. I mean, the way that 911 was pulled out of SPD was totally chaotic. I wasn't here for that. I came in basically to try to clean things up, but you can't. The technology and the systems are completely interoperable. So we sort of own the CAD, computer aided dispatch. That's our technology, but that plugs into what's called RMS, a records management system, where police are actually, legally obliged. That's where all the police reporting is happening. And so you can't separate them. They basically, it's a marriage and we both have to maintain them. What the city council thought was, oh, we'll just take it out. We'll take it out. You're civilians now. And that was really problematic from a policy perspective too, because we're not civilians. We actually have a much higher threshold of behavior, even like on social media, things like that. They're first responders. We can't make accommodations the same way another department could. And so we defaulted sort of to this city policy that doesn't work. I can't have a dyslexic dispatcher, for example. And that the city policy would say, yeah, you can, you just make an accommodation. So at this point, we're in pretty good shape. I worked really hard on rebuilding the relationships, which were really fractured. And when I arrived, it was still, folks on the whole were not real fond of SPD. And then on the other hand, I've got folks who are absolutely from policing families, married to cops. And so there's just a lot of tension. I'm very pragmatic. I always default to a belief that people are well-intended and they're doing their best. And I think it was useful for me to just figure out, what am I solving for? I was defensive of law enforcement right away because I thought, oh, the city makes them go to everything. That is not the police chief's choice. That is the executive. You have to go. Your police, they do homeless response. They are required to do that by the executive. They are required to screen these calls first before fire goes. They're required. I mean, all of this stuff, we make them go and then we hate them for going and policing social issues. And so I've been very public about that it is a failure at the executive level to not set up what we want. And that I feel a ton of reverence about. I understand the communities that I'm really working for. I do. I was just with Omari Salisbury, runs Converge Media, and just did an interview with him. And it was really special to be in that space because it's never lost on me, that this is one of the few things that was demanded in 2020 that happened. And for me, it's not happening fast enough. There's not adequate investment at all. If you look at all the positions that get added to SPD all the time, it's like overnight, you got 6 more leaders, you got 2 more of this, you got 2 more of this. Again, I support that department, but if we want to actually have a third public safety department, we need research and analytics, we need technology, we need staff to be able to do it. It must be 24/7. That's really important. And our budget's doubling because of those contracts. It's still $70 million. The fire department budget is about $350 million. The police budget is closing in on $500 million, I'm sure. Even the human service department budget is close to $400 million. So we're getting a lot done, but I feel like we've got to start to invest in breaking the cycles, in public safety, not just the triage, not just arrest, maybe book for 6 hours, you're back on the streets causing harm. That is expensive and it's really inhumane. And so when people ask me how they can help lately, I'm starting to say, write to your elected officials and tell them seriously, let's do this thing because we've laid the foundation now. I'm 3 years in, we know how to do this. It is being considered the national model in a lot of places. And I would like to prove that, to Aaron's question, the city could look different. Right? It could, but you would have to invest in the right first response and in the technology that would ensure we're tracking somebody into recovery rather than just 48-hour pause and you're back out.
Amy, on that note, I'm going to throw one at you real quick. I was so excited to introduce you that I completely failed to introduce myself.
I feel like you're known.
Yeah, you'd be surprised. I'm always meeting new people. So I'm our neighborhood safety coordinator for GSBA. And on that note, many of us that are on this call or just outside of the parameters of this call work in nonprofit spaces, work in BIAs and property management, kind of all the things. So aside from writing to our elected officials, what can we do as proponents of those spaces to continue to support care and continue to elevate the work that you and your team are doing and to continue to be good partners for you and better partners for you?
Yeah, I think in addition to the advocacy, it's fun for me to remind elected officials that we made a promise and we're going to keep it. We're not walking back. I'm not real fond of the new SPOG contract. It's more exclusionary than helpful in some ways. What was really useful about it is it makes care permanent. It says this is all legislated. This is a permanent fixture in public safety. It's not a pilot anymore, and we're not restricted in headcount. The feedback loop is really useful. I think it's been the same with officers. I always try to tell people, you're not going to offend me. We're developing this and it's lovely when we get compliments and things go well, but it's also really helpful to know when it didn't, to be able to analyze that and figure out, okay, where is the disconnect? Sometimes it's a structural issue. We don't call designated crisis responders for involuntary referral almost ever, meaning collectively we don't. The reason for that is 2 things. Number one, we're uncomfortable infringing upon somebody's civil liberties. We just are. And that makes a lot of sense. But the other thing is that it will take an hour, 2 hours, or 3 hours for this person to show up. We don't have time for that. We got 911 calls coming in. And so I wouldn't know that except for that people tell me. In fact, I had Dominique Alex, who's the CEO of Mary's Place, recently pulled me. We were both on Gurmai's transition committee. And at one of the meetings, she was like, Amy, I got to tell you about this call. And she herself called 911. She is, again, absolutely the most credible possible reporter about what she was talking about. And she could not get a response. Even though she was saying who she was, and she knew I would want to know that. It was very helpful, not so I can go lecture people, but so I can figure out, all right, what was my dispatcher hearing or understanding? And then again, why did officers come and not care? And when officers came, why did they do this? And so please continue that. Reach out. There's also like a care info email. There's some like care chief generic something. I read everything. And if I ever don't respond, it's because I get 2,000 emails a day. It would never be intentional. Send me the email again if I ever miss it, because I think, core to public service that I am responsive. And then, sometimes it's just me pushing on another department, right, or another leader to say, you need to answer this. I have no idea how to. So I see. Okay. I like, so the T-Mobile translation app, good comment. And Hillary's question about transit police. Again, it's really interesting jurisdictionally. You've got Sound Transit, and then you've got Metro, and they're not really part of the public safety system, even though a lot of stuff is going down on trains and buses. And so we had offered, and all the leaders have been great to me. I want to make that clear. Like Todd Morrell, the Metro chief, it's fantastic. Everyone's been very supportive. But when I had asked about a year ago, can Metro call us directly? If it's in the city of Seattle, CARE should be able to go, right? Regardless of if the thing is moving or not. And the answer I got was like, no, let's wait for the contract. So I don't know why that was, but I can tell you it's 2026. And anyone in Seattle should be able to call 911. We should be saying police, fire, medic, or mental health. If you say mental health, you should be able to get that right first response. We're going to screen for weapons, right? Sometimes we're going to want a co-response, or we know we have to send someone else. Co-response meaning CARE and fire, or CARE and police. But it should be uniform. It's the jurisdictional stuff. I detest it. I feel like it shouldn't be the zip code lottery where you happen to stand. The joke that Kat made is right. It's like, hey, we'd love to help you, but it's 11 a.m. and we don't have that, or it's 7 p.m. and that's closed. And so I just want uniform 24/7, starting in Seattle, and then I'm definitely working at the county level with the sheriff's office and King County Public Health and all of those folks, because there's a moral imperative to this. And also I'm trying to socialize and train people to understand they should expect that right first response. Oh, thank you, Heather. Heather sent me a lot of nice emails, so someone very good to respond to. Do you see elements of the CARE model being adopted or adapted by other cities in Washington state? Absolutely. I mean, this is the most fun thing for me. I'm from Southwest Washington. I've got a lot of friends east of the Cascades. And I don't think people realize how uniform the desire is to have these new first responders. I'm on several different statewide work groups, and when I talk about how half the calls have nothing to do with fire and police, it doesn't matter where in the state I am, everyone nods. Everyone knows that. And I think the silver lining of these sort of pandemic levels of suffering that we have, the only silver lining is it's kind of uniform. And I think it's making us more empathetic, that this isn't just a downtown Seattle thing. You don't only have, addiction in populous areas. You don't only have homelessness in this one neighborhood. It's just, we basically have neglected to address these issues since the 60s. We have, we knew asylums were bad. We closed them, and we said we'd do community-based resources, and we never did. And so I always reject the notion that this is all political at the federal level. I feel like, no, we've all been horrible in this space my entire lifetime. And nobody has set up the thing that we needed by the data until now. And, we had the Cahoots model, some of you are aware of. Again, I was a Portlander for most of my career prior to this strangeness I'm in. The Cahoots started in the late 80s. I was in grade school, and they were proving that it was safe for civilians to go to these calls. And the name came from, people think it's an acronym. That's not what it's from. It's because the joke, it's Eugene, right? So it's like hippies and bands. And that was the joke, that you had these like kind of, progressive hippies who were in cahoots with the cops, and what a scandal that was. But in truth, they proved something really important, which is you don't want the zero-sum game. You want real logic and compassion about what do we try first, and who best to talk to this person. And now here we are. It's cool. When I started, and I was studying what am I solving for? What do we know nationally, and kind of plugged myself into these different research hubs. And learned quickly Albuquerque and Durham are best in class for different reasons. And there were 74 pilots, meaning not full departments like CARE, but 911 first responder teams that were not sworn. Sometimes it's outsourced to a nonprofit, sometimes in-house. There were 74. Right now, I mean, the last I heard was, I think it was a year ago, we were at 130. And I bet you it's 200 at this point. It is just becoming incredibly normalized and understood. And when I'm teaching about it, I usually say, you had law enforcement, 1838, 50 years later, we have a fire department, 60, 70 years later, you go, oh, we need medics. Actually, we need dedicated EMS teams. And then we stopped. We just stopped. And even though we had escalating rates, if you think about the Vietnam War and you think about, suicide statistics, and you think about all that we've come to understand about trauma, all we've come to understand about, this grown-up committing heinous acts was very likely a victim of heinous acts. And so we've learned all this, but we didn't do anything about it, at least in first response. We just tried to give cops more and more and more skills. And it is fundamentally a different discipline. It's just a different discipline. And so, occasionally when I'm presenting with my husband, that's the most fun thing for me. He's retired now, which is, why he has time to make me tea. But when he says, we will not arrest our way out of this, that is very powerful coming from him, because he was trained that they would in the 80s, right? He was trained, we just need more arrests and more bookings and everything will be fine. And now he's, squarely in that rehabilitation side, advocating that the carceral system is not healing, and we are not exiting people better neighbors than they entered. I've developed this thing where I just take a question and answer it however I want, whatever I want to talk about. So I think I am becoming political. Hippies and bands. Newsletter, yes, endorse it. Question about the new mayor's office. Yeah. Okay. So the question is basically, how does the new mayor and new administration impact CARE? This was not a bad thing for our department. It was not. I think I got to know Katie just as a person a while ago, and she has asked me many of the most intelligent, perceptive questions I have ever been asked. She again, she took some hits during the campaign because it was like she was a defunder. I think she was actually like a lot of people, myself included, which is, we need other stuff too. You can't just keep pouring money into one part of the system. You've got to build out intervention strategies and prevention strategies and these other things. And so I think that she's really sincere in her conviction that this is needed. She's very respectful of me and of the department, the leaders. We actually had our CARE Awards, our second annual, which is really cool, just a few days ago. And I didn't know she was coming. She came, and it was really cool. She hung out at the dinner, and everybody was she's very approachable. Everybody's talking to her and asking her questions. And then she spoke for a few minutes. Her deputy mayor was there. Lisa Dugard now is in her office for 6 months. That is a good thing for me. This is somebody who uniquely understands the system. And I think of myself as kind of the next wave of what Lisa started in the early 2000s with diversion. So we're in good shape. I think this council, the new council members, are very sincere in their support as well. What else? I see a thank you. You're welcome. Oh, collaboration wise, I didn't answer that part. If I can influence one thing this year, and you all can see if I'm successful, I think homeless response should be integrated into first response. I think if Health One goes out post overdose and they're getting somebody into the Orca Center, connecting them to treatment, and they don't also have access to emergency housing, it just doesn't work. It doesn't work. If it's like we can solve half of the structural issue in this person's life, but the main thing, you've got to file a request in an app, and it's going to go through some coordinated entry. People have explained it to me 100 times, and I still do not understand it. It is so convoluted. And Kelly Kinnison, who runs the KCRHA, I really like. We've become good friends too, and she agrees with me. We just need to simplify it rather than having this totally isolated team. And I know that Katie really campaigned on homeless response and how we should do this. And there's something in between do nothing and sweeps. right? I mean, there's really successful teams. Co-lead's one of them, where there's just you just need to take a minute, take 2 or 3 or 4 weeks and figure out who this person is and what's going on. And if they're declining, why is that? And 9 times out of 10, you can illuminate it, especially someone with lived experience, and help somebody indoors into stability. And then obviously provide the supports and treatment needed to remediate the issue. So, okay, Deborah, sorry, I went on a tear.
Oh, no, that's fine. So thank you. I just wanted to ask you a question. You referred earlier to the fact that the care team and the police have very two different skill sets. Do you still believe that to be so? Because it's still foundational to understanding the why and what's happening to somebody.
Yeah.
It's just basic. Is that still what's being happening, even with the training, the change in training that's underway? No?
Yeah, I should restate that. What's interesting is there's a lot of upskilling together. De-escalation training is the same, right? It really is. Scene security, motivational interviewing. If you're a CIT trained officer, you learn all of that stuff. What I should say is they're different lenses. So again, if you have Amy Barden and Eric Barden looking at a situation, we are analyzing exactly the same sort of empirical situation through a really different lens. And I think that's what really good law enforcement officers know. They don't really know what's possible if you are a clinical person. And they also acknowledge that the uniform in and of itself implies something. It implies a law is being broken, you need to be corrected. And so one of the issues we're having every day is that SPD officers will cancel care, meaning we're supposed to dual dispatch. Law enforcement gets there first. The care responders are coming and they'll go, yeah, no, don't come. They don't want services. And it's driving us nuts because we're like, they don't want services from you. If a cop asked me, if I'm unsheltered, like, do you need my help? I'd be like, no, thank you. I'm good. It's that to me is just so basic. So again, I've got a lot of respect. We've got a lot of really good, extraordinarily skilled law enforcement officers. But if you're wearing that gun and a badge, just fundamentally, there's going to be a different vibe. Good question.
Is there work underway to build a relationship between care and the actual, police officers? How does that happen? How do you do that?
Yeah, it was better, I think, in 2023 and 2024, because when I started, I wasn't so much in the public sphere. I was just hopping around the precincts all the time. I was going to roll calls all the time. I was asking officers, what do you not like to go to? Where do you think you're useful? The first pilot team of 6 did the same thing. That was a lot of our work. 2025 was a bad year with regard to relationships because you had all new leaders come in from the outside. I don't know them. Again, lovely people. So it's not, but you've got this loss of relationships. And it's also, I think, the vision. If you haven't been listening to us babble about this the last 24 months, I think it's pretty abstract for police chiefs. And I spent a lot of time around the country with police chiefs. And at first, it just feels like, what? No, that's not safe. What if a social worker gets shot? You can't have unarmed responders. And then I'm always like, well, what if a firefighter gets shot? We've had unarmed responders forever, right? So you design for the safety. But yeah, we are working on it. It's top priority. The jurisdictions where it goes well, it's always in lockstep. It is. I talk to Chief Scoggins all the time. It's just interrelated, interconnected work. And ideally, we would all train up together. Ideally, you would have tons of co-response in addition to care response, meaning there should be lots of caseworkers going out with SPD to high acuity calls. That team has grown to like 7, even though it's been in place since 2010. Same thing with Health One. If I could grow one team, I would have 200 people in that unit, and there's 7, and we really need more of it. So
I just want to add something on that too, that I think a lot like what Chief's describing is that like macro level where it's really complicated. You have a lot of systems that impact that and interfere with that, and election cycles and budget cycles and all this fun stuff, and changing leadership. But on the person to person, the like rank and file level, we have a lot of really good support from officers, partly because they're the ones having the direct experience, where like our responders consistently report they predominantly get repeat users. So once an officer has a positive experience with the team, they go, oh, that was much better than me having to do it. Yeah. Wonderful. Okay. Thanks. Bye. And then related to that too, we do actually training in conjunction with CRIT grant where we work on trainings being led by POISE through UW Medicine, University of Washington's program where they've been building like kind of the premier training system that folks can come to all throughout the area for co-response. It's like really a leading national model for developing something that's new, right? That has to marry the clinical skill set development with also things like field safety and it's a different environment than a lot of us do work. I mean, I did most of my work for a long time in an office setting. It's very different than doing it out at Third and Pike. So a lot of it is also just that, like, we train a lot on like, what are ways that we can share our perspective with an officer? What are ways that we can say, like lead with curiosity. Tell me like, what is it that's making you think this person needs to be ITA'd? And can I share like, okay, I think they might be willing to go to this other resource voluntarily, or we've seen them before and we've seen this result where if we can get them back hooked into this support network that exists, we don't have to start from scratch and we can have that kind of interaction with the officer. So I think, more and more as the team gets more defined, knowing each other's scope, each other's role, the areas where sometimes officers will say, hey, this is a thing where they need like this type of emotional support. You look like you're good, I'm going to leave. And then other areas where the team says, this is my recommendation, but ultimately this is like an enforcement decision. So whatever you think is best.
Awesome. Thank you so much. I know I could talk to you all literally all day, but sadly we are out of time. Kat, Jacob, thank you so much for coming in and having this conversation with us. So for those of you who don't know, Amy hates titles. So all of the Dr. Bardens popping up in the chat are making me giggle a little bit. So I threw them at you in the beginning. I will not do that to you at the end. So Amy, thank you so much for coming on, even during a time when you have a cold. Always appreciate the insight from this whole team. I appreciate you chucking your email address in the chat too. So I know there are probably still a ton of questions out there. Amy is gracious enough to have you contact her directly. If you need to go through me, please feel free to utilize me as well in that space. But thank you so much. Appreciate it. Appreciate the time. And it's so good to see you all.
Yeah, thank you. I was not going to miss this. You all are my people. Keep inviting me to your parties, and please do reach out with anything. I have yet to decline an invitation ever to connect with people or answer questions. So thank you. And Jen, thanks for all you're doing to advance visibility and awareness and compassion and logic. So appreciate you.
Anytime. Have a good night, everybody.
You too. Thanks. Bye.